It is National Cervical Health Awareness Month, and famous sports reporter and TV host Erin Andrews just recently posted on Instagram saying, getting tested for cervical cancer could save your life, just like it saved mine. And as women, of course, we all lead very busy lives, but just like Erin said, there's still no excuse for not getting tested. And we have Tiffany Bass-Flug, she's an RN, to talk a little bit more about the importance of cervical health. Thank you so much for coming in.
Thank you.
I'd like to say that men are worse than women about taking care of their health, but sometimes there's not enough discussion about cervical health. Is that fair to say?
That is. And January being Cervical Health Awareness Month, we like to promote cervical health. It doesn't get as much spotlight as, for example, breast cancer.
Right.
So yes, there is very much of an importance around cervical health as well.
What can women do to prevent? Can you prevent cervical cancer or issues?
Yes, cervical cancer is a very preventable and very treatable disease if it's caught early. So we have some really great tools that we can utilize for cervical screenings, the Pap test or with a combination of the HPV testing, which is testing for the human papillomavirus. And the human papillomavirus is one of the main causes of cervical cancer. And then also we have a vaccine, the HPV vaccine, which vaccinates from the human papillomavirus. And that vaccine we like to give to 11 and 12-year-old male and females. And the reason we like to give that, they're already getting their middle school immunizations. They are likely not have been exposed to the human papillomavirus, but the vaccine can be given up to the age of 26. But again, great tools that we have that are easy to access and readily available.
Yeah, HPV vaccines for our girls right now. It does generate a lot of conversation. It did at first. Now some numbers are coming in, I think, too, as well, that people are taking advantage. Is that correct?
Yep, we're still, there's a lot more room that we could get a lot more males and females both vaccinated with the HPV, the human papillomavirus.
Can we talk a little bit, too, because I feel like this has changed. I was asking you in the break, and we kind of ran out of time, because you brought up the Pap. And it used to be yearly, and you were tested, and that was one of the tools to find early detection. But that's changed somewhat.
It has. Cervical cancer is a fairly slow-growing cancer, and a Pap test can typically, a lot of times, find precancerous cervical cells. So going from having somebody tested every year and having the scare and having maybe more biopsies than are really necessary, they've gone to every 3 years. And to start at the age of 21, and then from 21 to 29-year-olds, we screen with every 3 years for a Pap test. They don't typically check for HPV in that population just because a lot of times at that age they can clear the infection themselves. Then starting at age 30 and older, they can have a Pap test every 3 years or a Pap test and HPV every 5 years.
And you're with the Grand Forks Public Health Department, but you said you're also kind of talking today from the Women's Way program.
Yes.
Can you tell us a little bit more about that?
So the Women's Way program is a great program for women in the whole entire state of North Dakota to take advantage of. It's income-based, it's fairly easy, and it's available throughout the entire state. It helps for women to pay for their breast and cervical cancer screenings. So what's included in the program is Women's Way will pay for their office visit, and within that office visit we typically do a clinical breast exam, a pelvic exam, and a Pap test. So we're screening for the cervical cancer, and then it's a good way to establish with your healthcare provider and having that relationship. Another benefit of the program is we also help pay for mammograms. So again, another cancer that if we early detection, we can prevent it and get a better take on taking control of it.
Women, we take care of everyone else. It's time also to take care of ourselves. Thank you so much for visiting with us today.
Thank you.
Stay with us. Coming up next, the hot new colors for 2019.